Good evening, everybody, and welcome to the 50th episode of Marvelous Medicine. Thank you very much for joining us. Today's proceedings will be conducted by Dr. Amit Ghosh, Dr. Ilango Sethu, and Dr. Ravi Shankar. Over to you guys. I'm going to sit back and relax.
Thank you. Thank you. I don't know whether I should call you Vidya or Dr. Vidya, because from what you have achieved and what you have done and bringing such so many stalwarts from all over the globe in the name of marvelous medicine, I calculated that over the 50th episode, by the 50th episode, we would have done at least 73.5 hours of just the superb compilation of medical information, administration, education, from a whole bunch of stalwarts whom we grew up with in JIPMER, but who have since gone all over the world, and also those who have not met in JIPMER, and also like Dr. Ilango, from whom I learned a lot. So I won't belabor too. I would say what our roles are going to be. We are going to be three moderators, and it's going to be Dr. Ravi Shankar, who's going to be starting, and followed by Dr. Ilango and me. We have assigned topics to individuals who are going to go over these areas which have been covered, to give us a very important feedback on where we are. Very often we are going, we don't know where we are. We haven't had a chance to reflect. What can we do better? Is it meaningful to continue this kind of activity, which I hope it is, but I'm biased. But what can we do better? I had written an article in 2008 about need analysis of CPD, where I figured out that when you're looking at how you have to conduct, the need is based on specific practice needs. Very often they need some kind of a gap analysis, clinical surveys, by observation of physicians, or self-assessment, that we find out that these are the specific practice knowledge we needed, and sometimes patients' unmet needs. Then there could be some proven needs based on external data, epidemiological data, audit data, professional society requirements by the news media, or gaps in the literature. And these brings about some of the CPD or CME stuff that we do, including mortality and morbidity studies, and patient satisfaction surveys. More important is also the inferred needs, which means there's a new diagnostic test which have come, which nobody knows. New medication has come, new practice things have come. There is recent advances. So we are going to have our experts who had a chance and spend a lot of time reviewing these topics to let us know how we can do better and what we need to do, or what we are doing good. So with that, I'll hand over to my colleague and classmate and very dear friend, Dr. Ravi Shankar.
Thanks, Amit. Thank you so much. We're going to get started with Dr. Subrata Bhattacharya. It's been ages since I've called him that so formally. He's Bhatta to all of us and will always remain so. And it is indeed a great pleasure for me to introduce Bhatta. All of you know him as, all of you may not know that Bhatta did his MBBS and MS orthopedics from JIPMER. And after practicing orthopedics for many years, he switched over to family medicine and runs a very wonderful and busy practice in Boston. In addition, Bhatta writes about several topics with great passion, tremendous compassion, and above all, a wonderful sense of humor that really resonates with so many of us. It's just, that is quintessentially Bhatta. So I'm going to, before I introduce Bhatta, I was going to tell you that one of the enduring memories I have of Bhatta was him taking a class for us once when we were undergraduates. And he started by saying, it was a class on entrapment neuropathies. And he started by saying that all of you know about Venkatachalapathy, but now you would have learned about arthropathy, encephalopathy, and today it's entrapment neuropathy. I have never forgotten that. And with that, Bhatta, take it away. and give us a critical analysis of the episodes that you had an opportunity to go through.
Thanks, Ravi. Thank you, everybody. And thank you, Vidya and Patta, for giving me this opportunity, because I could hardly be called an expert on anything except for two things: drinking coffee and enjoying the sound of my own voice. And I do not think that actually qualifies for anything spectacular. But I have to admit right at the beginning, outside of participating as a participant in one of these episodes, I did not watch any of these live. I watched them subsequently on YouTube, and it was fascinating to see the variety of topics that were brought forward. I have a couple of observations about that, since Amit said this is also an opportunity and a forum for feedback as to where we are going. I was asked by Vidya to look at 5 topics, and these were antibiotics for surgeons, trauma-based approach to pain management, virtual medicine in India, stress management in physicians, and pedagogy in surgery. And what I thought I would do is let me get to the meat of what I was being asked to do and give you my critique about this. At the onset, I will tell you, doing this is like being an art critic or a film critic. You do not need to paint. You do not need to act. All you have to do is to tear down the people who actually do the job. So criticism comes easy, but criticism may not always be constructive. Praise is often easy to do, but praise may not be authentic. So we got to walk a fine line between to figure out what is it about this thing that worked and it didn't, because there is no topic that worked spectacularly and there's no topic that failed spectacularly. We learn both from our successes and our failures. So what I've done is I've taken the topics and the ones that have been the easiest for me. And understand, again, I have my own personal biases as to how I interpret these subjects. I've taken it from the ones that have been easiest for me to comment upon and going on to the most difficult ones. And the first of that would be the trauma-based approach to pain management. I thought it was a fascinating topic because mental health and pain are two issues that are difficult for physicians to understand. There is no testing that is available for that, which is reproducible and measurable in metrics. If you fell and fractured your little finger, you'd automatically get an X-ray. But if you went to a doctor and said, I feel like I want to become a politician, no one would scan your brain because it wouldn't give you any answers. So for things like pain, mental health, we are shooting kind of in the dark. And I love the presenter's way of taking it on. He took on chronic pain, which is such a difficult subject. May not essentially be for the ones for surgeons who deal more with acute pain, but it took on chronic pain, which is shared by the surgical brethren, which is the anesthesiologist. And he had a fascinating presentation about it. What I liked about it is he gave an organization of the work structure in which he had understood about his skills. He presented what his experience in the UK was, and he gave you the UK experience of what he had been doing and broke it down into being that pain is like a poisonous lasagna. It's multi-layered. There's layers and layers of interpretation of things and how much trauma plays into it. Some of the things that we are not actually taught very well in med school. So for the younger people hearing, it may be a good idea to take away that pain itself, the answer does not lie in a bottle of medications or in a nerve block or in an interventional procedure. I thought what worked in this particular topic was it was focused, it was directed, it was a little bit one-dimensional, one note, but it stuck to the note of where he was going. And because it kept between a narrow lane, there was not an overwhelming amount of information that someone had to take. What probably didn't work in this was at the end of it, you came away saying, okay, I get it. I get that pain is not so simple, that it is multi-layered, but if I were to deal with it, what do I do? Perhaps what I might have wanted to see, and it's difficult to do because the presenter presented mainly from his UK experiences, what are the resources available to a young surgeon, someone who has just come out of residency and has got a patient with chronic pain? What are the resources? Where do you turn to? Something about that, and where could you go for doing a literacy search? What are the resources that are there that you could connect virtually? It might have been helpful. That was an easy topic to look at and see in terms of what worked and didn't work. The second one was antibiotics for surgeons. Again, a little bit of a one-dimensional topic. Loved the presenter. Gave you his connections between clinical medicine and the pharmaceutical world, told you the different hats that he was wearing, laid out his stall very clearly. So it kind of defined the borders, what he was going to talk about. What worked for me here was he gave you a broad, because antibiotics is, everybody uses antibiotics. Very few people are specialized in this. It is like using a fountain pen. Every one of us knows how to write. There are very few Shakespeares amongst us. You know, we all know what to do with the antibiotics. We just don't know how to finesse it out. And he, I think, laid out some a very workable structure as to what one should be doing. Where I think it lost me a little bit was the emphasis on just an antibiogram in the hospital. Maybe I speak because of the UK experience here more than an antibiogram, and the fact that we do have more ID specialists here. What we tend to do is there are resources. There are resources in terms of manuals, textbooks, online resources where you could get a breakdown of what antibiotic would be the drug of choice. For the younger surgeons, I think younger surgeons and clinicians, I think a direction towards that would have been very helpful. Other than that, spectacularly presented, very well held together, and certainly held my attention for the entire duration of the presentation. Moving on to the third topic, which I found interesting, was virtual medicine in India. Now, because of the pandemic, virtual medicine has been forced on all of us, whether we like it or not. So while we spent our spare time watching YouTube videos and TikTok videos, not all of you, but some of you, now we were forced to actually interact with the patient in terms of a video format like they're doing right now. And many of us realized that, one, we have an inner thespian inside us. We are wonderful actors with the camera. We probably do better interacting with the patient. Two, we learned that the patient behaves slightly differently when they're in their home environment. They have a cat that you have never seen before and who wants to wander into the picture. And three, that it takes a certain skill to interact virtually than it does in real life. In real life, what happens is the patient comes to your turn. You are in charge. You're in command. It's your consultation chamber. It's your room. It's your team that sees them. The patient has to adapt. What we had to learn as physicians in the virtual world was we were adapting. We were interacting with the patient on their time, on their terms, on their connectivity, on their audio quality, and learning to make it into a profitable. I think what worked the best for me in this was there were first the anecdotal experience that Vetturi provided. That was very well laid out, simple, to the point. This is what I did. He did not go on to try to make a meal of it by giving more interpretations of it. This is what I did. And from then we branched on the ICU experience. How can doctors themselves share virtual knowledge? It doesn't have to be a doctor-physician interaction. And I thought the presentation encompassed vast amount of material. Interestingly, nobody talked about artificial intelligence or where things might be going in the future, because in a few years' time, I don't think we will need to interact with the patient face-to-face. Probably be interacting with some kind of an algorithm on a computer or a screen, very much like what we do when we call a banking helpline or something like that. No, you do not speak to a human being, you speak to a computer algorithm. So interestingly, nobody touched on that. I wondered why that was, but that's probably because they were presenting their own unique experience. But that, I think, was a very topical and relevant subject, considering the fact that this was a pandemic and we all had to recalibrate how to do. From then, let's move on to pedagogy in surgery. And this was presented by Elango. And I will characterize him as David Letterman of medicine. And for people who don't know who David Letterman is, he is a late night talk show host who I quote a lot because David Letterman breaks everything down into bulleted points. He has lists. David Letterman has the top 5, the top. And I was fascinated when Ilana was speaking. One, he had a mastery at his command. He was able to blend in the anecdotal experience with the data that he wanted to present. But everything was broken down into lists. His lists of how to do things, his lists of what you wanted to do. I think he finessed it to the point that everything that he presented, before I even heard it, I'm already waiting. Where is that list? I want to hear it. I think it was wonderfully done. I think it was a very nice presentation between what we learn, how we learn, and what we should learn. If I can fault him for anything, one of the interesting things he did not present is a person like me who's in their 60s is now training medical students who are in their 20s. I have learned in a different environment and in a different structure. And I'm trying to teach somebody who has grown up in a different environment and structure. I have not done high school in the 2000s. I don't know how people interact and how they think. I do not know how they learn. As my son tells me, today you don't need to go to school. Google already teaches you everything you need to go. You go to school to learn how to do the things that school doesn't want you to know. Otherwise, you can learn it all on Google. So perhaps there might have been a role here to say, where does new teaching come in? How to interact with an old world surgeon, how to interact with somebody who does not want to teach you in the new style, but wants to teach you by apprenticeship, which is you are the disciple, I am the teacher. You watch one, you see one, you watch one, you do one, and then you go on to teach one yourself. That's probably the only slightest criticism that I would have, but otherwise a brilliantly done presentation. I think one which is very topical because each one of us struggles in our learning in various residency program, and we do not realize how much bias and personality comes into teaching and learning. If you do not get along with your teacher or your trainee, it can be a sham. And then finally, I think the most difficult topic for me to look through was stress management in physicians, which Dr. Bala presented. The things that worked wonderfully for me was how personable and anecdotal the whole presentation. Right at the start, when he started with his credentials, I said, there has got to be a personal story somewhere in there. Nobody speaks like this. This is a practiced talk. He has sung this song before, and I was not disappointed. He certainly, at the end, you learned the path that he had walked to get to this point and to reduce and to find a different direction. This is not just stress reduction. Many of us have walked very many different things in life. The way we practice medicine today is not because of what we learned in medical school, in the operating rooms, or in our consultations chambers. What we learned in life. And more than that, what we learned not to do in life. So it's our life experience that we bring in that makes us better or worse. That is why I found this a little difficult, because in the middle of that presentation, Bala had something that made my ear stand up. He said, the patient will lie to you. The patient will sue you. The patient will go against you. So you have to keep guarded against that. And I thought to myself, no. This is not what you tell young people. If you go into the hospital, very often we see this. When you treat the patient as first an enemy or an annoyance, you should not be practicing medicine. You have already gone into medicine for the wrong reason. If you cannot see imperfection in people and accept that you do not mind somebody who sues you and you say, he sued me, but yet I tried my best because that is what I was trained to do, then you're wasting your time in medicine. This is what I have learned personally. So that was the part that was difficult for me. Self-help or cognitive behavioral changes things or motivational pieces are difficult to do. it is hard to find the balance between information, guidance, and cheerleading. And very often, motivation becomes cheerleading. Nothing is more terrible than telling somebody who is depressed, don't be depressed, don't get anxious. Because if they knew how not to be depressed, they won't be depressed in the very first place, you know. It is like having somebody who cannot see well, and I should know because I wear fairly thick glasses, standing in front of an eye chart, and you're telling the fellow, read the third line, and the guy says, I can't read, and you look at him and say, I'm not trying hard enough. It's very demeaning. That is where I think a lot of motivational self-help things fall down. What's the need? The spectacles. Give him glasses and he'll read better than you. So that is the only criticism I have about Bala's talk. But otherwise, I think a wonderfully detailed anecdotal chart. Those were the pieces that I was asked to cover. I personally felt that this whole experience was wonderful. And I loved the title, Marvelous Medicine. What it showed to me was what a marvelous life is there outside of medicine. Because I heard the many things that so many people have done. And I realized, you know, we go through medical school thinking that life is medicine. That's all it is. We live medicine, we breathe medicine. That's what we do. And we die medicine too. This showed me that there's a wonderful life outside of medicine. If you bring that facet into your own life, I think you're a better clinician, a better physician, a better human being. And it's also an opportunity, you know, to see how many interesting things people are doing. I think it's easy to get into a rut doing your own thing. And I cannot commend you, Vidya and Patta, to bring these things together. And even though it started out mainly aimed for the surgical resident, I think this has blossomed into a beautiful thing. And I, for one, would personally love to see this continue. 50th episode, we should be having the 500. That will be a day to celebrate. And I am going to sign off with that. Thank you.
Woody, you're muted.
I'm muted. I just realized it. Thank you, Bhatta. That was, as always, wonderful. Very pithy and very relevant comments. I just wanted to let you know that, you know, the last part, keep that in mind because Vidya is branching out. There is going to be a series that will engage you even more, if I can say that, if I may say that, but stay tuned. With that, I am going to move on to Tilaka. So we're going from, you know, old fogies like us to someone, a breath of fresh air, a young critic. Tilaka, when I asked her how should I introduce her, she said, I am someone who is learning something new every day, both in my personal life and in my professional life. She is an anesthetist who's in charge of simulation in Apollo. And the reason why she feels like she's learning something new in her personal life every day is that she's a new mom. She has a 1-year-old daughter. So with that short introduction, I am going to ask Tilaka to cover the episodes that she was asked. In the interest of time, can I ask Tilaka to keep it really short so that you know, we can get everybody and all the episodes covered. So apologies for sounding like a timekeeper here, but I'm unfortunately we do have to do that. So thank you, and I'm going to mute.
Thank you so much, Dr. Ravi. Am I audible? So that was the warmest and the sweetest introduction I have ever had. And a very good afternoon, a good evening to everybody. Thank you so much, Vidya ma'am, for giving me this opportunity. Like a few days back when Dr. Vidya called me and asked me to be a reviewer for a few of the topics, she said, you know, like you just have to look at the topic selection, speaker, duration of the talk, and some fairly objective things. So I was like, okay, that's going to be easy. That's not too much of a problem. But then as I started going through each and every episode, I just realized I am absolutely not the expert to do this at all. Even before I go into each of the specific topics, the one thing that I'm going to say is all the topics were absolutely mind-blowing. So I'm going to give first, I will just pass on a few general comments and then I will go to the individual ones. I will try to keep it as brief as possible. First of all, congratulations to Patta sir, Vidya ma'am, and the entire team for pulling this really difficult feat. I don't know how they managed to do this with the busy schedule that they have in the clinical work. I mean, like every week, Thursday. I mean, I keep waiting for most of the topics. So congratulations to the entire team. And the speaker selection for all the topics was just spot on. I don't think they could have had better speakers. They just didn't get experts, but they got experts who could really cater to a general audience also. So awesome. The speaker selection and the moderator selection was absolutely spot on. And one thing that was common among all the topics was the talks just lasted for something like 40 to 45 minutes, some even lesser, which allowed a lot of scope for discussions. So if you, I mean, anybody who's attended this will know that there is a lot of discussion that goes on after the talk, which is again awesome. So I'm just going to jump to the topics right away. What I'm going to do is, because I'm not going to give a review of anything, because like I told you, I'm not an expert. I'm going to talk about what went through my mind, what I liked the most about the topics as and when I started going through them. So the first topic, because I am into simulation, obviously I took it up, was simulation in surgery, which was presented by Dr. Dinkar Pai and was moderated by Dr. Ananthakrishnan. Dr. Dinkar is an absolutely amazing simulation person. So his talk automatically was very useful, was very practical. And apart from mentioning the various trainings that can happen in simulation, the most important thing that I liked about his talk was that he actually told how to integrate simulation into the curriculum and how important it was to do that. And so his talk was awesome. But when it came to moderation, the first thing Dr. Ananthakrishnan started off was like the disadvantages and the drawbacks of simulation. I was like, what's happening? But then I realized that they never gave a patchy picture about simulation, which happens in every simulation talk, because everybody keeps talking that simulation is absolutely amazing, awesome. They, in fact, after listening to that talk, I realized a few of the drawbacks myself, which I was not aware of. So the entire talk, if somebody has listened to it, they will have a wholesome picture of how simulation is useful, what could be the possible drawbacks of using simulation-based education. And Dr. Dinkar was a super sport, and thank you to Dr. Dinkar and Dr. Ananthakrishnan for bringing out what is usually missed out also in simulation-based talks, apart from the usual ones that would be brought out. So with that, I'll move on to the second topic that I viewed, which is hand surgery, that was presented by Dr. Jimmy Matthew, moderated by Dr. V. Purushothaman and Dr. Tarun Agarwal. I have to admit that I have become a fan of Dr. Jimmy after listening to this talk. I don't even know him, but I have become a fan after listening to his talk. His talk was filled with anecdotes. It was so lively. There were a lot of personal things. There is a story about calorie, which he said, which I'm not going to reveal. I'm going to leave it for all of you to go and find in case you have missed it out. So apart from covering the general aspects of hand surgery, which would really interest the general audience also, he covered very relevant topics like validation, accreditation, training, and about why plastic surgery stands at the place it is right now. During the moderation and discussion, I really loved the fact that they had called Dr. Nagaswamy, who is an anesthetist practicing plastic surgery for years together. So that also was brought in, his experience was brought in, and the entire discussion was completely wholesome. So that again was an amazing talk. And they did not just touch on hand surgery, but a lot more about each of the specialties and why somebody would choose one specialty over the other, which was like truly awesome. And I think it really requires guts to touch on such topics in such a general forum also. So that's about the hand surgery. The next topic that I went in was artificial intelligence in tracking COVID. I will be truthful. This was presented by Dr. Shyam Vishweshwaran and Dr. Kavishwar, moderated by Dr. Ravi and Dr. K. Narayanan. I was really unsure about the topic when I started, because I am not at all a tech savvy person. But the talk just lasted for 35 minutes. And in that 35 minutes, Dr. Shyam and Dr. Kavi beautifully covered what they had made in a very, very simple way. It was absolutely not complicated. I thought it might be difficult for me to understand, but it absolutely was not. I was able to understand what they were trying to make. They gave a general idea and ignited an interest in data entry, in making sure we have to be involved in getting all these things done. So generally, all of us are into one patient and we are interested in our own hospitals. But after listening to the talk, I truly realized how important it is to collect data so that like we have a general picture, we have a wider picture, not just at a regional level, but also at a national level and an international level. So that is something that truly opened my eyes. I was completely unaware about all these things. So that topic is something that was truly new to me, and I was delighted after after listening to that topic. And there were a lot of talks about future collaborations which were planned in the middle of the talk. So I'm going to request Dr. Vidya to keep us updated, or Dr. Sham to keep us updated about what happened about that after I finish the review. So that again was a brilliant talk. The fourth one that I went through was Surgeon in the ICU by Dr. Dilip Raman, which was moderated by Dr. Biju. Again, a topic that could have easily become very technical, very specific, and could have easily gone about the head for so many people. But Dr. Dilip kept it so basic. He stuck to the basics, and and I really love the fact that apart from mentioning the common things that are to be done, he also mentioned what not to do in an ICU. So it was truly targeted to a general population who could be in an ICU. And when it came to the discussion, I'm not sure how many of you have listened to that topic. There were a lot of uncomfortable things that came up in the middle of discussion, but all of them were super sports. Like they never made the discussion uncomfortable. They all stuck to science. They shared their opinion and they stuck to what was science. And Dr. Dilip kept repeating something in the middle of his talk, like it's not important who is right, it is important what is right. And I think all of them were super sports, though, like they brought out a lot of uncomfortable discussions, but everything went so smoothly, everything went so well. Everybody believed in science, everybody believed in evidence. So that is something that was really nice in that topic. And again, that was one brilliant presentation. So the last one that I went through was Introduction to CRS and HIPEC by Dr. Ramakrishnan and Dr. Meenakshi, which was moderated by Dr. Amit Chauhan and Dr. Nitin Singhal. Again, a very, very specialized topic. So because I do HIPEC surgeries, it was okay for me. Again, I was having an idea of it's so specialized. How will they even cater this to a general audience? But the way they had made the presentation, they had made the concepts very clear. It was very simple to understand. So that again made me remind of one thing that as a trainee and as a faculty also, I missed in AIMS. We used to have clinical combined rounds and clinical grand rounds where every department used to come and present. And one of the senior pediatric surgeons used to call me and tell me to go and attend, because the one thing he said was, you can't just be inside your own specialty and know what's happening only in your specialty, attending conferences in your specialty. You need to know what is happening around you, what a surgeon is doing, what a pediatrician is doing, what a pediatric surgeon is doing. What's the whole point if you don't know what's happening to your neighbor's cabin? So I guess this marvelous medicine has opened that possibility of making it, like making us understand what is happening in various fields. And I can't commend Dr. Vidya enough for whatever she is doing, for the way she moderates session, for the way she keeps up time. And, like she keeps saying, you better do your homework well. I'm sure that is how she's doing it to everybody. So, I mean, like, this is awesome. Really, I mean, like, I'm so glad to be a part of it. And I wish that this program continues. And like Sir mentioned already, we will meet at the 500th episode, or even an episode that is a higher number than that. Just one small suggestion, if I may. I think we should increase the visibility for the amount of hard work that is being put by all of you, and for the amount of information that the speakers are giving. I think we need to do more justice by increasing the visibility of this program and making it available to more people. So again, I leave it to the experts on the field to decide as to how to go about it. So thank you so much. I hope I finished it on time, Dr. Ravi. Thank you.
Yes, absolutely. You did a great job. Thank you so much. And I think those were very insightful comments. And Tilaka, the whole point is that you should not be an expert. How do you, as a non-expert, relate to these talks? Because that's the whole idea of this whole series. So you were spot on. And we're going to have to switch just a little bit. Amit or Ilango, who wants to go next? Because the other two people that I was going to introduce are busy and will only come in at the end. So one of you take over, please.
Thank you. Yeah, Dr. Amit,
Ilango, you can go ahead.
Yeah, thank you. So I have three critics with me. I'll start with Dr. Suma Balan. Is Dr. Suma here?
Yeah, she's online.
Yes. Yeah, she's online. Okay. Dr. Suma is someone whose writings I really admire on her Facebook page. She writes a lot of small anecdotes, which are really humorous and reflect how life is for a postgraduate and for young trainees. And it's really nice. She did her MBBS and MD from JIPMER and did her training from UK as well. She returned to India in 2009 and now heads the Pediatric Rheumatology and Immunology Department at AIIMS Kochi. She is a friend of quite a few of my close friends who work there in the city of Kochi. She shares quite a bit of common interests: cooking, blogging, movies, patient advocacy, and feminism. I welcome Dr. Suma to discuss her topics. It'll be very nice to hear you talk. Thank you.
Thanks, Ilango. And as I said before, this is a fangirl moment for me because I really enjoy the way you write it. So my first topic was surgery sans knife. And see, at the outset, I must say that many of the speakers selected for Marvelous Medicine, a good number of them are already known to me from my undergraduate, postgraduate days. And somebody like Matthew Cherian was somebody whom we looked up to very, very much when we were undergraduates. He actually opened up the Department of Radiology and showed us what radiology was capable of when I was a student. And so, you know, I heard this entire talk, I've heard it twice, and it's simply amazing. His passion, the way he structured it, the way he, you know, outlined it for a general audience, and he covered, went from the basics. What do they do in interventional radiology? What materials they use? What procedures they do? Where they can be of help? And why it's important for everyone to think about involving an interventional radiologist. Because I work in a setup where we have a big interventional radiology department, so most of it is familiar to me. But still, it was really, I mean, this was spellbinding, I would say. The kind of examples he gave and the anecdotes he gave were absolutely spellbinding. And I think you know, his talk was so nicely tuned. The only problem was the duration of the discussion probably was not enough for all the questions that came. There were so many questions after the talk, and you know, the discussion got a little bit wrapped up with the obstetrics, where there were a lot of surgeons also wanting to ask questions, so that had to be balanced out a little bit more with time. And so there were a few questions that couldn't be taken up, which I think possibly was the only drawback I could think of. And the only other thing was probably the mention that the surgical backup should be available in the same place if the intervention procedure should fail. It's a vice versa thing. Both ways, you know, surgeons need to have intervention radiologists and backup, and intervention radiologists need to have surgeons. And I think, you know, this is fantastic, this procedure, this entire talk. And this is a talk that, you know, I think even any cadre of doctor can listen to and learn from. So I'll move on to the next one, pedagogy in medicine. And again, a senior whom we all looked up to a lot, Amit Ghosh. I mean, been he's been a standout person with regards to academics, with regards to ovation, with regards to elegance in his presentation for a long period of time. So a very, very good choice of speaker, I would say. And he brought it out, such a objective, scientific presentation. At the same time, he added in anecdotes here and there to make out his points a bit in a clearer manner. See, many of us, I'm a teacher too, many of us do stumble into teaching and we pick up points on the way. We do a bit of training, but there's so much science to it that Amit brought out that it makes me rethink many things that I do and makes me think how I can do things better. And if Amit was good, Amit was great. I think the moderator and the discussants in the talk were simply phenomenal. Dr. Sethuraman kept coming in with, we all know Sethu's one-liners, wise one-liners, and they were, really very, very useful. But Dr. Ananthakrishnan is absolutely standout in that discussion. I still remember the way he spoke about the the problems he faced as a teacher then and as a teacher now, and the difference in student attitude being one of the main things that changes the whole picture. And it, it I think the entire talk was so much the richer for every discussant who brought in their questions and brought in their observations. And I think Dr. A.K.'s input about the evolution in medical education is something that was very, very interesting and really enriched the entire evening in that discussion.
Suma, could you hold the mic closer to your mouth? Can you hold the mic a little closer to your mouth if you're using? Yeah.
Can you hear me now?
Yeah, better.
Better? Okay. So the next topic I was discussing is pediatric obesity and anesthetic implications. Of course, being a pediatrician myself, this is a matter close to heart, and it is something that we all, as pediatricians, are increasingly concerned about, but society isn't adequately concerned about. And when I say society, it's also doctors outside of those who deal with pediatrics. I think even they are not adequately concerned about the mounting childhood obesity that is actually trending. It's very odd because when I was training in pediatrics in India, malnutrition meant marasmus and kwashiorkor. And today, actually, we deal with both sides of malnutrition. We deal with very, very little bit of protein energy malnutrition. We deal with a lot of the other end of the spectrum. The speaker was both the speakers. So there was one speaker, Dr. Subhashini, who dealt with the pediatric obesity and how to approach it, how to manage it, and Dr. Devnath, who dealt with the anesthetic issues related to pediatric obesity, which I think would have been very, very relevant for all the surgeons in the audience. Both of them were really outstanding. I mean, Subhashini actually brought in such a wealth of her own personal passion, her own personal journey, and she was game enough to share even her daughter's journey in the process and the positive story from that, which made the whole talk that much more meaningful. And Dr. Devnath was so practical, so evidenced in the way he brought out his suggestions. That was also fascinating to listen to. The only thing was, having two experts, it was a long evening. And I don't know, it was okay for me because I walk up and down and this increases my step count, which is good for me on the whole. But I don't know about how it would have been for the viewers that day, whether it would have been a bit too long for them in all, because there were two entire talks. The discussion was moderated by a very, very able person, Dr. Shripati, a pediatric surgeon who was who really handled the entire moderation with aplomb. It was so beautifully done. He was well in tune with both the speakers, the medical, the surgical, the anesthetic, all aspects were very nicely handled with the discussions and the questions involved. A session that I enjoyed a lot, a session that I think actually needs to be aired to all, people who deal with children's um, health in our country. I was slightly disappointed when I went to YouTube and downloaded the session to see that there have been less than 200 views on what is such a highly relevant topic. And I agree with Tilaka that all of the Marvelous Medicine series do need to reach wider audiences in some format, because there is a wealth of information in each and every topic that's being presented here. My last topic, pharmacogenomics. I will say that, this is an area where I myself have a very steep learning curve. And when you have a very steep learning curve, anybody can impress you, especially if they manage to actually pitch the talk at the point of where you are. And having said that, the two speakers are absolutely phenomenal. Sandy is my junior. I know him from my school days, actually. And, it's been a great matter of pride to see the way Sandy has risen in his life, in his professional life. And Eric, who was the other speaker, clinical pharmacist, academic clinical pharmacist, was simply phenomenal how so elegantly he was able to explain the basics, the nuances of pharmacogenomics that kept me fascinatingly glued to the entire talk. And I think, that's what I say. It's a topic that many people may think that, oh, I don't want to listen to this because I don't know anything about that name. But no, you must go in and listen, because these guys have pitched it perfectly right. It's literally at the level of you've done MBBS, you know that these conditions exist, you heard of these various drugs, you know these drugs sometimes cause problems. Why do they cause problems? How can you improve your practice? They pitched it exactly where a clinician can pick up and learn and move on. And it was very nicely done in that Eric gave the talk and then Sandy led the discussion to incorporating the questions from the audience too. Add in all the gaps that came from there and improve our understanding much more. The only thing I would have added is, if there are Indian centers doing pharmacogenomics, it would have been nice to have them in the discussion, and so that we know what's available to us in our country from this country. So I'm stopping here with that. Before that, I would really like to give a 3 cheers to RK, Vidya. They're all people I know really well. This has been a fantastic endeavor, and it has been a way of making the drought of COVID meaningful. And thank you very much for that.
Thank you, Dr. Suma. You speak as good as you write. Thank you for those nice words about our speakers, and we're actually very happy to have you here. We'll move on to the next critic. May I invite Dr. Vasanthi? Is she there, ma'am?
Yes, I'm there.
Yeah. Dr. Vasanthi was the former director of Madras Medical College, and one of the finest things I read about in her CV was that she trained 75,000 undergraduate students at the Speed Institute. A phenomenal number, ma'am. She was responsible for the prep course for the DND anesthesia PGs. She's the founder of the Anesthesia Academy, and she was the past president of the Indian Society of Anesthesiology, Chennai City branch. She's an author, she's a speaker in multiple forums, and a renowned teacher. Ma'am, welcome to this forum, and the podium is yours.
Thank you so much, Dr. Ilango. Very different from what Dr. Subrata and Dr. Suma said. First of all, regarding the logging in, several times I have done most of these talks, I have listened. It's not on YouTube. Most of it has been live. So much so that sometimes I had even logged in on a Wednesday evening only to realize, oh God, today is Wednesday. I have logged in 24 hours too early and then sheepishly logged out. So I have listened to it continuously most of the times. And secondly, like Dr. Sumar said, most of you are familiar with each other, whereas it's not so with me. But having listened to you all over the so many episodes, I find myself so connected to all of you. Thank you so much for that. And of course, Vidya and Pata, there's no need for me to say anything at all. And all of them, and there have been certain common characteristics in all the episodes. All of them have started on time every time. And Pata and Vidya and the whole team, Ravi Shankar, Amit, all of them have been like so involved in whatever they are doing. So that made the big difference. So when you say something and you get involved in whatever you're saying, obviously the audience reaction is so much better. So that is what I saw. And of course, not to mess Vidya's aesthetic dress sense and her matching accessories, which I always admire every time I do. Okay, now from now on, I go on to the serious part of it, to Dr. Subrata. I think I'll start with Dr. Subrata first because I heard his mom is not too well and I hope she gets better soon. So I'll start with him. So he spoke about team building, right? He's obviously has many years of experience on this topic. But remember, and he's been in this team building and starting from orthopedics, going to family medicine is not easy. And how he has adapted himself to USA from orthopedics, especially from orthopedics to going to some other specialty itself is quite a task. But remember that he is also started from zero experience as a team member. So everybody has to start somewhere, and that is what he said. And that's what he said. And he started off with not much support. How he and his team sailed through rough and calm weather is his story. It came out so beautifully. He gave us 5 points. I can't remember all the 5 points offhand, so I've written it down. It's a 5-point structure which he has followed diligently, namely the purpose, participants, resources, very important, right? And the safety net protocols. And he touched upon each of them. Very, very beautifully, he touched upon each of them. And then he said, and he gave some relevant examples too, which was quite interesting. So what I would say is, he said about familiarity breeding contempt. And he said it's not always so. And when familiarity, of course, need not breed contempt, and it can actually make somebody more predictable, their response more predictable, and you get more tolerant, right? So that was a very interesting part of the whole thing, saying that you get familiar, you get more tolerant. It's something which happens everywhere, isn't it? It happens even at home, right? And what is important, and another important, his magic word was aha, right? His magic word was aha. But remember that after that aha, there is a lot of issue to be solved. It doesn't stop with just that. And I think that he brought out very clearly. And Dr. Sharma, I think moderator was Dr. Sharma, and he shared his perspective in the Indian context. And he kind of, many of them, they're kind of similar. There are certain things which are similar, certain things which are definitely not similar, because in an Indian setup, we can't have the similar attitude or the similar thing here. And what he insisted was on taking full care of your team, which was very different from what Dr. Subrata was trying to say. And of course, what is similar in both the things were both the communication skills, leading by example, learning to respond to a situation than reacting to it, and not just saying, aha. I think that was the take-home point, is to do something about it, okay, not just react. You take the feedback. He was talking about feedback. I think Dr. Sharma spoke a lot about feedback that comes in, and he says sometimes you take the feedback and throw it into the dustbin, but the person who gives you the feedback should not know about it. I think all those things made a big relevance, and so it was good to have both of them around and give us a perspective about team building. But remember that we have to have our own protocols to build our own team and make it work. So that was the essence of that talk. I think I'll go on to the second one, which is, I think it's PPH. That is a topic which is very close to my heart because I have been an obstetric anesthetist for over 40 years. I just love to do obstetric anesthesia. And PPH is, and mortality due to PPH, at somehow or the other, we have to kind of limit it and make sure that it doesn't happen. Dr. Lata spoke, like having seen her and being in obstetric anesthetist for so many years, I can see that she's a very well-read, very practical, very knowledgeable obstetrician. So that is what I deciphered from her talk. And what she said in a stepwise manner, starting off with the medical management and then the massage of the uterus and then about the surgical skills, all those things. And then she also spoke about the logistics of doing interventional procedure at some point of time. So that was very well spoken. Dr. Rajaram was simple, but simply brilliant. I think we need to thank him for coming on to this forum. And thank you so much, sir, for taking so much interest in the welfare of the women in this world, in India especially, and taking up the placard to save lives of young mother. I think it is so, so important. Thank you so much, sir, for being here with us. And of course, he was so generous enough to even donate his own blood to save a patient. I think that was just phenomenal. Being a clinician, being there, I think hats off to him for that. We really love you, sir. And he spoke about the long-term consequences and to give attention to research and to do a good follow-up and how to train postgraduates. I think that is what is very, very important. We need to keep the baton going. We need to keep the thing going. So he spoke about that also. What was very, very interesting was Dr. Vidya. He was so impressive, and coming from the Northeast made it even more interesting because we know what it is in the Northeast, what is a medical system there. It is quite difficult for them. And there is a paradigm shift from home delivery to the hospitals. And he spoke one word, which was so gratifying. He said, it gives an opportunity for the doctor to take care of the patient and treat the patient. So I think that made a big difference. And people like him who are at the ground level are people who need to make protocols in their own setup and make sure that we have to do something about this PPH. And I think as the obstetrician, the anesthetist, the admin, the government, everybody must put together and start a project, some kind of a project, and probably you can just call it Project PPH, and prevent death due to PPH. That was the second topic. So third one was academics to administration, which is also something I have done. I have been an academician. I have also been an administrator, and now I'm back to pure academics. I don't do any more administration. So I could relate to whatever Dr. Geetanjali was saying, and I think that's what happens in most of the most of the administrators. So what happens is we have a attitude among the people who work under you. We can't say under you, who work with you. Who have a thing saying, I have the right, I will do this, without taking up responsibility. When we come across such patients, such people, is what Geetanjali spoke about at length. I think it was just wonderful. Her experience and a careful, calculated approach to any problem was what she said. It was very nice of her to have remembered all the people who paved the path to where she is today. A travel, a WHO, meeting up with people, all this, and adapting to a system has obviously been her recipe for her success. Politics was the word which she used, which was very interesting and had a lot of hidden meaning. So I think it's a very good catchword to use, politics. I think, and then she mentioned about how she was started as a frog, and I think this frog has now become a princess and a queen. It's not a frog and a prince, it has become a princess and a queen now. And if she writes down her experiences, it will be very useful for the future. So that's what I would say about Dr. Gitanjali. And then coming to palliative care, Dr. Abhijit was at his best talking about neglect of dying. And then he says how painful and expensive dying has become. And being alone at the time of death is a horrific experience and all that. And then he said, we are being programmed. We are not being taught. We are being programmed as doctors. We are not being taught to be healers. So he said, we are just being treaters. You're not being healers. I think we need to do both. I need to do treaters as well as healers. So it's not enough if you just treat, or not enough if you just heal. So, and he went on to say a lot of things about a lot of anecdotes and a lot of pathetic situations where we see patients really suffering and all that. So we could see and feel his passion for his own field of palliative care, which requires a lot of patience. And it was just phenomenal. The way the work that he's doing is just phenomenal, and God bless him. I think Mallika as a moderator, of course, was very good, because that is her passion too. I know her for several years, and that is her passion too. But what they mentioned was, they did make a mention that we should include it in the curriculum, right? But seriously, we need to work on this and decide how much of which we can take as a medical student. Now, every specialty, every subject, everything is important. But how much can we take in a curriculum in a medical, in that 5.5 years, 4.5 years? We know all of us, some of us had gray hair even when we were 13, 17 and 18, when we went to do anatomy, physiology, just to write a 10-mark question. We have so much already. We are overburdened with our curriculum. So we need to somewhere sit, and the administrators probably need to do about it. Okay, I think about that. And then, of course, he said, what he said was, what was very interesting was planning for death. We must plan for death as much as we plan for the living. And he made death sound so interesting that I'm now awaiting my turn to experience it. It came to that level. Like he said, oh God, that's the way it should be and all that. So that was very, very interesting. Okay, so I'm coming to the last topic, which is so close to my heart. It's the surgeon and anesthetist relationship. Having gone through it in personal life and in professional life for 41 years. So I'm sure I'll be able to say something about that. Okay, the biggest example of this surgeon anesthetist relationship is the marvelous medicine itself, right? We have the title, which is called LGS. It's called Learning General Surgery, right? And Pata is there. And Pata and several surgeons, physicians, everybody is there. And then Vidya is conducting it, right? So here we know, what more do I have to say? Do I say that? No, actually there is much more to say, because everybody is not Pata, everybody is not Vidya, everybody is not Dr. Sridhar or Dr. Raghavendra, the two speakers who came up that day. Dr. Sridhar spoke at length about working under different environment, with different work culture, under different formats. I think that's what he said. And it is obvious he's a very friendly person. It's very obvious that Sridhar is a very friendly person and gets along with most of the people who work with him. Tattvamasi is his principle. And people who work with him are lucky and blessed. That's what I would say. But coming to the other side, have you ever seen an anesthetist throw a laryngoscope, a blade, or something if it doesn't burn, if it doesn't work when you're trying to intubate? But have you all seen surgeons throw things around when it doesn't work, when an artery doesn't catch, it's around the theater, it's just thrown around the theater. That kind of a disruptive behavior inside an OT does not speak so well of the surgeon. Like if you're an efficient surgeon, I don't think you will be doing that. You're actually very good at whatever you're doing. I don't think that will be the attitude. I think that needs to change, because there's nobody in that particular topic. He also said about superiority of one over the other and things like that. And Pata threw a question at me just like that, as if I'm going through an emergency. I was not even prepared. I was just sitting and happily listening, very quietly listening to something. And in the meantime, was listening to this surgeon anesthetist relationship. He suddenly threw a question at me, and I answered it immediately, like I was going for an emergency section. And I said, and I very clearly said, like I always feel, genuinely feel that the patient is the most important person in the team. It is not the surgeon or the anesthetist or anybody else. The surgeon, they are all equally important, but the patient is the most important one in the team. If you remember that, no, you will not have any problem at all. Of course, Dr. Raghavendra quietly came in and said about his experiences with Dr. Sridhar, and they have a great relationship. And that was, of course, excellent. If you have, that is something which needs to be there. And he spoke quite at length about the changes that has happened over the years. About, like I always keep saying, if we are giving open drop ether, you can't be doing open heart surgeries. So that is my punch dialogue. So all the so much of improvements have happened in anesthesia, in surgery, in the technique, everywhere. So that is what has happened, and that has made surgery and anesthesia a very pleasant experience. When that pleasant experience comes, the relationship improves. So that made a big difference is what I'd like to say. And of course, I would like to say from my own personal experience, and I have been with the same husband and the same surgeon for past 41 years. And he says it can be by he said certain important things. He said it could be by compulsion, it could be by choice, it could be by choice. So I think by choice I have done this. There are certain times which you have to do it by compulsion too. So sometimes you can't help it. But honestly, you must remember that the patient is the most important member of the team. I think that's all I have for the review of the whole thing. But we just enjoyed thoroughly being with all of you. And we learn a lot by being in this forum. And I made so many new friends. Thank you so much, Vidya and Pata, for that. Thank you.
Thank you, madam. Thank you.
Ilangu, can I just interrupt for just 1 second? Soma is on call and he just has a small window right now. So is it okay if he goes in next? Thank you so much. I'm sorry, apologize for interrupting you. So please finish what you were going to say.
No issues. I think we'll get Dr. Soma to talk.
Thank you. Fine. So when I asked Soma what I should, something unique about him to introduce, he had the most interesting response to me. He said, he's a perfectly imperfect human basking in his imperfections. Now, that could be true for all of us. So thank you for putting into words what most of us feel, Soma. That said, he is an associate professor of anesthesia at Sri Ramchandra Medical College with interest in simulation, medical education and research, spirituality, neurosciences, health and fitness. And with that introduction, I'm going to have Soma go over his topics, the talks that he's going to cover. Just a quick request, please keep it brief because we are, stressed for time right now. Thank you.
Thank you, Dr. Ravi, for the wonderful introduction. I think this marvelous medicine, it's fantastic. I wish many more episodes, maybe 50 episodes should move on to 500 and maybe to 50 years. So my best wishes to Vidya ma'am and Dr. Pata for carrying forward this. It's a wonderful thing. The best thing I loved about this marvelous medicine is that it just takes me away from the day-to-day practice. I'm an anesthetist, which by profession, so sort of a stressful life that I lead inside the theaters. But then this is a fresh breeze that just takes me to different aspects of medicine. Not just different aspects of medicine per se, but then I get to meet virtually though, lots of fresh faces, new friends with different perspectives. So it's a great learning experience for me as well. So I have been asked when Dr. Vidya contacted me, I think I was the fastest finger typing to say yes. And then she told, okay, you are caught. And then when I told the topics like, okay, you are going to have the maximum homework because your episodes are the longest of all. And then, I thought, oh my God, I think Dr. Vidya had a catch, and then she just made me, I think I was caught somewhere. But then all the 3 episodes were fantastic. And the first one is the role of social media in medical education. And then I think Dr. Shiv he's an anesthetist. I'm associated with him for the past 9, 10 years or so. And then he's a wonderful human being. I know him in person. And then the talk was wonderful. He took us through the journey of different theories of education, medical education, and how the medical curriculum has changed a lot, and how the social media is playing a very important role in medical education. Though it may not be the primary role for a medical education, but then it has its own role where the trainees are very free to speak to any expert without any hesitation. And then you have access to the world, the access to the career, access to their medicine, access to their knowledge on fingertips. And the session was made interesting by Dr. Pata with his lots of questions. That was very wonderful. I must say, the social media, the role of social media comes with its own harms as well. The next topic I had was artificial intelligence and the physician. So when I had gone through the video of that, and then when I opened my Facebook, every 4th or 5th message would be like to have asking me to do a course in artificial intelligence and join some Harvard and everywhere. And then that just pretty much sums up how the artificial intelligence plays a role along with the social media, along with Facebook. So the social media, I'm part of the anesthetist group, and then it's very I had learned a lot from that group as well. It changed lots of my practice, and it improved my skills, knowledge, and as a human being as a whole. So I have been gained by social media, and then with the talk by Dr. Shiv, it has been more of insights I have learned with that talk. It was a fantastic talk, and the best thing that kept going was the interaction by Dr. Pata with Dr. Shiv in that session. Moving on to the next one is the role of artificial intelligence and the physicians. I think Dr. Shyam, I think I'm a novice. I had attended a couple of conferences out of interest. What is artificial intelligence and where does anesthesia fit inside and so on. So I had a couple of friends who in US were talking about the AI in medicine, and then when we were discussing, he was telling me like, even though the artificial intelligence may come into role, it will never outperform human doctors, because we as a patient, I'm as a patient, I believe that my medical needs are very unique, and it cannot be addressed by the complex algorithms. I may drive a Tesla that's completely self-driven, but I may not allow a self-driven artificial intelligence to take care of my health. Probably that may be the current scenario, but then it may not replace the human doctor, but then the role it may play may be pretty much, maybe in in a decade or so, it will increase a lot. And then Dr. Shyam did a fantastic job of giving a perspective of what artificial intelligence is and and how it is utilized in medicine, and what all the challenges that it faces. So I think even for a layperson who with an understanding of an English, he will be able to understand how the talk has gone very well. So that was a wonderful talk. The third one was a topic that's close to my heart. It's the health and fitness by Dr. Vijay Bose. That's around 3. That's the biggest drill that Dr. Vidya made me do, watching all episodes each around almost 2 hours each. So it was like a fantastic thing. It's actually, I thoroughly enjoyed all the 3 episodes. So I'm into sort of fitness, like I do yoga, meditation, swimming, gymming. I do like I wear all hats, and then it's like I carry a 3-liter bottle, a water bottle, to my workplace, so that I don't miss out on my daily quota of water. I think that that's a very important aspect, especially the health fitness part for doctors as such. Many physicians, they're all overweight. They prescribe, they suggest lifestyle changes to their patients, but then they do not follow it, probably for lack of time or for any other reason. But then that was a very fantastic eye opener in those 3 talks. I think that was the 3 talks were, though it was a bit lengthy, took few more minutes, but then each part did its own justice to the topic that was chosen, how eye fitness is important, and what are all the different ways that you can cater to your fitness. Why not just one form of exercise or yoga or Pilates, whatever it is, it's not going to help you out. Why it has to be a multimodal approach is going to be very beneficial. And the secondary interventions and how your sleep and stress management is going to be important. It's a fantastic topic as a whole. I think this LGS should focus on making this much more public, or advertise these episodes that can be made more available to the public, because it's not just for medicos or doctors. It's going to be any common layperson. If he's going to watch it, he'll learn lots and lots of pearls. The only pitfall that I found is the time that it took. It's around 2 hours each episode. But apart from that, all the 3 episodes were very good. Probably a few more thing, or maybe I think I was a part of Fitter group. Most of you would have been knowing about it. So similar to that, probably LGS can take an initiative further to improve the fitness of the community that we are working with. I think this marvelous medicine should move forward with great leaps and bounds. I wish all of you a great success. I'll sign off here. Thank you. Thank you very much.
Thanks, Soma. That was very nicely summarized and very succinctly done. So thank you so very much. And also thank you so much for not calling me sir. So thank you. With that, I'm going to hand it back to Ilango. Take it away.
Yeah, thank you, Dr. Ravi. I've got one more senior anesthesiologist to introduce. Before that, I just wanted to say, Dr. Vidya, I mean, when I look at look at all your friends, I'm really jealous. You've got lots of friends all over the world. I mean, a man's life should be measured in the number of friends he has. And I'm sure you have many, many, many like this. So just an interlude. So I'm
blessed in that sense. They're all better than me. That's the other good thing.
Awesome. I'm introducing Dr. Raghavendran, who is currently the Director of Anesthesia at the SIMS Hospitals. He's a very senior anesthesiologist in the city of Chennai, an experience of about 40 years, much more than what I have as an MBBS student. I mean, it's phenomenal. He's a very popular DNB teacher and is very actively involved in the anesthetist Facebook page. So welcome aboard, and the podium is yours.
Good evening, Dr. Everybody. Thank you, Dr. Ilango Sethu, for a very kind introduction. Actually, Dr. Vidya gave me quite a lot of homework. I think she gave me about 5 topics, and each one took nearly about 2 hours or so, and I was trying hard to find if I could differ from, with all, at least some points where I can sort of put in some sort of comments, but it was quite a challenging one. I'll see if I can make some attempt to sort of give some sort of criticism, or I don't think I can give any adverse comments. All were quite classy and very well presented. Now, first to take off is high-risk bariatric surgery. The topic selection was quite appropriate, as the presentation was on bariatric surgery in super morbid obese people. Very scary to see people with weighing about 450 kgs, 500 kgs, and walking to the theater and positioning themselves on the table. That was a fantastic sight. And the selected person to give this topic has a very vast experience in doing bariatric cases over a period of 15 years. He has not done anything other than bariatric operations, so he's very well fit into that role as a bariatric anesthesiologist. And he's got a good, very large number of cases done, over nearly about 5,000 cases, quite a big, large number. And he highlighted all the problems so well. Little bit of, certain slides could have been omitted for sake of brevity, but the skill expressed in tackling these cases was amazing. And there are a lot of emphasis on teamwork and cooperation, which really brought out so well. The surgery does require a multidisciplinary approach. There were some debatable points here and there, like say nasal intubation. Not many anesthesiologists would agree with that. For morbidly obese patients who are many times present intubation difficulty, and we always take the simple way out. However, the preferences of each anesthetist may vary, and that's how he is used to, and he has done it with a lot of skill. And what was amazing was the excellent track record of safety and success. He says that he never had any mortality with any of his patients, and whatever mortality occurred maybe 1 or 2 months later because of some surgical leak and so, not because of anesthesia. That was excellent track record. The audience participation was excellent. I thoroughly enjoyed that program because I can being an anesthesiologist, I can very well relate to his expertise, very well relate to his field, and then enjoy his presentation. And the moderation was done very well. And this moderation and selective moderators has been done so well, and the trend has continued through all the presentations so far. Now moving on to presentation on corporate healthcare management by Dr. Chandrasekhar Ramamurthy. It was an excellent presentation. Not all medical specialists would venture into healthcare management as they prefer to dedicate the time and effort into patient care. We all come into a comfort zone. However, he has shown us that there's a way out also, and you can get into healthcare systems, health management systems also. And he can understand, as we understand the nuances of medical care much better than the non-medical counterparts. So we've got an added advantage because we know what we are up to and what we can do. The topic was made very interesting one, as the speaker dwelt into the scope and need of healthcare management, the mindset needed for being successful in this area, and the seamless process which aids the successful running of the institution, both in private and the public sectors. So, and he has given an alternative career path for doctors. And normally, people choose, when they are almost about to retire, they go into management side. But he has shown that you can also go into that management from a very early stage. And the financial gains of choosing the area is very well highlighted. And this is definitely one path which is open to personnel who have got such an aptitude, leadership qualities, and other non-technical skills. So I think we learned quite a lot. I think it was quite a motivating presentation, and definitely an alternate path into which many medical personnel who have got a capacity to motivate others and make others work can really take up this path. Then next other one is the living bill. Okay, this actually, I was not knowing anything about this. So in fact, I had to look up the dictionary and find out what exactly it is. And they made very, very clear by a non-medical person. And thank you, Dr. Vidya, for inviting Justice Kannan Krishnamurthy. Did a wonderful job. He presented a very lucid and eloquent manner. It was all, as usual, well moderated by experts. And we could get a real insight into the legal process involved in the living will, or otherwise known as the advanced directive. And now we know that it could be very, very cumbersome and very delayed and prolonged. And however, no, we can't escape the law, the process of how the judicial system works. So we have to go through all this process as such for a proper, the way of doing things. Little do we know about the legal implications of end-of-life care, euthanasia, liabilities of medical person involved, especially in this ICU care, and the interaction with the legal expert have cleared many doubts in the minds of the medical personnel. So there are quite a lot of questions asked and were very well answered by the speaker. And I feel we should definitely be having more such topics in the future also, by touching upon consumer protection, medical legal problems, and certain arising out of adverse outcomes of patients, etc. There are very many doubts raised by audience speaks volume about the requirement for discussion and information about such topics in future also. So I think definitely we can have more of these topics later. Now moving on to the next topic, which was for review, setting up an emergency medicine department in the hospital. It's a very well conducted program, stretching for 2 hours, involving experts in emergency medical care who share their wisdom on various aspects, like barriers for setting up emergency department, operation, structure, advocacy, education, opportunities, etc. A thoroughly enjoyable program. Relevant topic which highlights the scope and need for emergency department in every major hospital setup. And once it is run well, can give the hospital the much needed facelift. The stalwart spoke with absolute authority and gave a lot of information on its scope of job opportunities in various setups. The discussion was of highest standards and well moderated by Dr. Arun Nandi. We certainly need to have more such topics on emergency medicine in future. I really looking forward to such topics in future too. Then coming to the last topic, which I asked to review, setting up an ICU in a tier 2 city. It was a very motivational presentation by Dr. Ganapathy. Not all would venture into unexplored areas with his uncertainties. But Dr. Ganapathy had persisted with his passion to serve the rural population and has come out quite successful. He has shown that anesthesiologists with their special training and expertise in dealing with acute situations can be of immense help, not only in resuscitation, but in other areas like emergency medicine and ICU. His presentation was very simple, but all could sense the sincere efforts which have gone to the development of a specialty service into a success story. This is an eye-opener to know that with determination, courage, and persistence, one could achieve the impossible. Fantastic presentation. It's amazing to know that not only ventilators, but other expensive items like, say, the dialysis facility, plasmapheresis machine, and the Mars facility could be put into good use to serve the people who have injected poisons or affected by snake bite. And he has continued efforts into training also paramedical personnel and nurses as well. And we could get a glimpse into toxicology and integration of anesthetic skills with ICU care, community service, and education. And Dr. Surajit Giri's anesthesiologist's presence and his comments added so much to the excellent information conveyed in the presentation. The other topic was Where Eagles Dare is truly inspirational, and the selection of speakers are very apt. Thank you.
Thank you, sir. Thank you for the wonderful comments on the presentations, and we'll hope to improve ourselves. Over to you, Dr. Amit.
Thank you, Dr. Ilango. We are at the 1.5 hour mark, and we are all fixed listening to the comments. And some of the comments are so good that I wish I could have taken my portion to my boss and saying, stalwarts in India are talking about me like this. Will this work for my next promotion? Because it was so good. And Sham, you just missed out, but I think we've got all this recorded. You can do the same at your area. Having said that, it's my pleasure to introduce Bala. He's Professor Bala Chandar. He's head of the department in Government Medical College, Trichy. We went to school together, and he proceeded to do an entire training in Tamil Nadu, and is a stalwart, having trained thousands of students himself. Bala, over to you.
Yeah, thank you, Amit, for the kind words of introduction. Am I audible?
Yes.
Yep.
Yeah. So, in the first birth anniversary of Marvelous Medicine digital learning platform, I take it as a privilege to give my feedback on 5 of the 48 presentations that were made in the last 1 year. And I would strictly abide by the guidelines given by Vidya over the feedbacks. And out of the 5 presentations that were assigned to me, 1 was academic and 4 was non-academic. The academic presentation is about nutrition in surgical patient, a very important topic rarely discussed by the surgeons and rarely practiced. So the speaker was Dr. Vijay Kumar, who is an expert anesthetist and an expert in surgical care. He told us a lot of new things. He said the preoperative nutritional assessment is mandatory, and the practice of pre-anesthetic lighting cocktail of diazepam, anticylagogues, and proton pump inhibitors are slowly given up. And he also said the 75-year-old Mendelssohn syndrome is disproved. He actually cautioned the surgeons about the use of IV fluids. Please do not drown your patient with IV fluids. And he's also said that enteral nutrition must be started as early as possible, 2 hours after regional and 4 hours after general anesthesia. Moderator in the session was Dr. Sriram, who said that anesthetists must refuse to give surgery patients who are malnourished. And he said if they give, it is equal to malpractice, which was a difficult question to answer by Dr. Vijay Kumar. He said, sir, I have to be surgeon friendly. And to which Dr. Radha was also posing a question, sir, how do I refuse a patient from coming far off if he is malnourished in a non-emergent situation? So that was a difficult question to navigate. So in the end, they all agreed that good nutritional status gives a good and the best outcome for patients. And all of them agreed that it is a teamwork. So nutritional status assessment should be done by the anesthetist, critical care physicians, surgeons, not to leave the staff nurse. So that was a very pertinent topic and a wonderful discussion by the participants. The second topic I would like to discuss is non-medical, is giving back. Now, this giving back was not actually a discussion or a presentation, but a sharing of inspiring stories by 3 doctor couples on either side of Atlantic. 2 doctor couples from United States, Dr. Arvind Krishna and his wife Ritu, and Dr. Sanjay and his wife Natasha. Dr. Arvind from Ohio, they drew the inspiration, they found their calling in the joy of giving back when they lost the son Ashwin. And they could carry on the dreams of the son Ashwin by instituting Ashwin Viking Scholarship. This scholarship was to encourage poor students who does academically brilliant performance, not only that, about humanistic values also. So they also encourage overseas scholarships with the University of Japan, with the Michigan University. And the beauty was that Arvind has made that this scholarship program will be a sustainable model, and that was the beauty in it. And his wife Ritu is a pediatrician and a certified yoga teacher, and she reaches out to anyone in physical and mental stress. And she shared a poem of her own, why she is inspired to give. And I think that will be pertinent to share with her permission. She said, why give? You give because you can. You give because to empower someone. You give because of compassion, and you give ungrudgingly. That was a wonderful poem to share, and it's deeply inspiring anyone who listens to the poem. The second couple was Dr. Sanjay and his wife Natasha. They were equally great. So they are from Boston. So Sanjay said, you can give anything you like. It may be time, it may be talent, or it may be a treasure. So starting as a football coach to the children of Boston, or acting as a foster parents to some of the children, or taking Hindi classes or teaching Indian history was his passion, and giving care to many, many children. And his wife, Natasha, found the calling in taking care of the Syrian and Lebanon refugees. So these two couples from US prove that that the US is not a land of milk and honey anymore. They need a lot of people to give and care. So the third couple is back home in Madanapalli, Andhra Pradesh, is Naveen, Dr. Naveen, and his wife, Shubha. So they started off in a very humble way back in 1999 in Madanapalli as orthopedic surgeons and ophthalmic surgeons. Dr. Shobha was saying that we must justify our profession in the joy of giving, sharing, and giving. So they started in a small way in Madanapalli. In mandals, they used to take care of the school children by giving camps, attending camps, and referring the children with eye problems to base hospitals. So their defining moment was 4 years back when they were asked to take up Christian Missionary Hospital, which was 109 years old, which was closed. So with a lot of effort, they could reopen this missionary hospital, and now they are doing a very good work in Madanapalli. Hats off to Naveen and his beloved wife. So in addition to the couples, individual contributions from Madras, Dr. Radha was saying, Dr. Al-Salvi was doing a great job for the children of poor socioeconomic status in Chennai. And Radha, Vidya, and Arul are planning to start the organization that is going to help the children economically and educationally. And Radha Krishna was mentioning that in and around Chennai, there are 200 and odd Jiparites, which they are planning to unite and sensitize them to have a dream project of making corporate hospitals to take care of the children by services from Jiparites. That was a wonderful dream to realize. Then we learned a lot of good things from our teachers, not only pediatrics. Professor Nalini Madam was sharing her way of helping children about hemophilic society. So she not only treats hemophilic children, but also educates them, empowers them. That was a great learning of kindness and compassion from our teacher. Not to forget Dr. Sivadasan. Now, Sivadasan started giving way back in the medical college days. He was discussing and sharing how we used to go with Professor Puri in helping the slum children. And there was a wonderful way of giving. Sivadasan has made it a point that to give 10% of a salary to charitable work. That was a great work by Dr. Sivadasan. And then we have evergreen hero, Dr. Ajay, who turned police officer into politician. So he was ready to offer helping hand to any of the organization, either in single or combination. Then we also had Nalla from the Gulf, who used to take care of the disabled children. Then from the land of Bengal, we have Punnudurai. So our senior, he was mentioning about to the audience, you have seen Royal Bengal tiger, but have you seen children who are maimed, killed, orphaned by tiger attacks? And there were thousands of children taken over or adopted by Punnudurai, and nearly 750 widows who are actually the victims of tiger attacks. So he used to take care of them medically and empower them through his educational stress. Wonderful work by Punnudurai. So the third topic was about palliative care, the care of the caregiver by Abhijit. So he is the president of National Palliative Care. This topic was actually totally new to me. So palliative care is relatively new and young to India. And then he said that palliative care, not everyone can be a caregiver. He said you have to be extra human, extra kind, and extra compassionate. And the end he summarized that, will he be the caregiver? That was a soul-searching question I must ask myself. So the fourth topic was about the burnout syndrome, a very, very common topic discussed by doctors all over the world, but rarely practiced. The Boneless Syndrome was discussed by Dr. Anbudurai from Chennai psychiatrist. He said this Boneless Syndrome is common with all doctors. It starts speaking when the doctors speak in their career, they keep on achieving, and they get a sense of surge through dopamine. But when they reach the highest, then after that, when they are not able to reach more and more, they start feeling the loss of accomplishment, which is one of the signs of burnout syndrome, what he called as honeymoon period. And he said we should not fall trap for that. So then there was Dr. Ilango. He said very, very valid point that we doctors must learn to say no. We are ordinary human. We are not extra human. At least for non-emergency situations, you must say, learn to say no. That was his very, very valid point. So that was about burnout syndrome. Then the last presentation was not actually a presentation, but a journey to Himalayas by Dr. Mahajan's brother, Hitendra Mahajan, from anesthetist from Nasik. So actually he shared his journey from Mumbai to Mount Everest. It was actually not a story. It was a saga of grit, determination, and raw muscle power, I would say. So he started his journey cycling from the sea level Mumbai to Kathmandu by cycling, then from Kathmandu to base camp by trekking, and then from the base camp to summit, peak of Mount Everest at 884 by mountaineering. It was a really wonderful journey, a great presentation, and then it was a nail-biting finish when he reached the top of Mount Everest, a defining moment when he took a photograph with our national flag. But every adventure has its own problems. When he was descending, he was temporarily hit by snow blindness, fortunately he recovered. But unfortunate that he was had a frostbite, had to be airlifted, and now, fortunately, reconstructive surgery, he could go back to his anesthetist work. A wonderful journey, a deeply inspiring story by Dr. Mahajan. I think he'll be a role model to anyone who ventures in adventurism. So these presentations were extremely nice and thought-provoking too. So my general comments about this marvelous medicine platform is that this marvelous medicine, it educates, informs, it entertains, and finally it socially connects to. So in addition to that, there are three unique features in which I would like to mention here. Number one is punctuality, two is consistency, and third is credibility. So when I say punctuality, the program starts exactly at 8 o'clock, and Vidya starts her opening remark by it is 8 o'clock now, as like a signature phrase of Doordarshan. So when she says 8 o'clock, you can keep your watch at 8 o'clock Indian Standard Time. That sharp she is. So the second is consistency. Correct me if I'm wrong, Vidya, that no Thursday is complete without marvelous medicine program. So that consistency they wear. The third is credibility. Now, apart from consistency, punctuality, choosing the topics, pertinent topics, great speakers, great anchor, Vidya, and the silent innovator, Radha Krishna, all of them earn a credibility for this program. I think you two people are incredibly incredible, I would say, in terms of energy and commitment. You see, Vidya is a very soft-spoken person, but she carries a big stick behind her back, and she intervenes when she needs to intervene in the appropriate way. She conducts in a very, very graceful manner. Hats off to you, Vidya. And Radha also always does the work behind the screen. And without you two, this program would not be successful. So before I wind up, I have two suggestions to make in the selection of topics and selection of speaker. Now, in terms of topic, so we doctors have a professional life for which academic skill is mandatory and non-negotiable, agreed. But we have other lives too. We have personal life, family life, social life, which depends upon the non-academic skills for our survival and the excellence in our other endeavors. So my suggestion here would be to be successful life. What do you want to be, whether a successful life or a satisfied life? The choice is ours. So to be that, to teach the younger generations, you can choose the topics 50-50, academic topics 50%, and non-academic 50%. So that will be one of my suggestions. With regard to speakers, I am not regular, as Radha would say. I'm regular in this topic, in this forum. So my suggestion is, when I see the name of the speakers, most of them come from the private sector and the corporate sector. My suggestion would be to be inclusive in the sense you can rope in many doctors from the government sector. Like me, I have 32 years of experience in the government sector, because we work in a different environment and ecosystem. So in government sector, we have different challenges. For example, dichotomy of resources, redistribution or maldistribution of resources. On one hand, we have human personnel, but we don't have infrastructure. On the other hand, we have the best of infrastructure equipment, but no personnel. Despite all these odds, we in the government sectors do deliver. We do what we do. To give an example,
Dr. Bala, I need to have you summarize. Sorry.
Yeah, okay, fine. So this is the last suggestion I would like to make. So it can be inclusive, can include doctors from government sector also. Thank you very much for this opportunity. Over to you, Amit.
Thank you, Dr. Bala. That was really remarkable, the amount of detail you went through each of them, that amount of time you took, your eloquence and your brilliance. Thank you. And I wish we had chat after the session is over at some point. Now, the next speaker is Dr. Ramesh, who is a consultant pediatric anesthetist in the Child's Trust Hospital. Over to you, Dr. Ramesh.
Good evening, good morning. Actually, I was asked by Vidya to review and feedback for the 4 episodes. So at the outset, I must thank Vidya to review, because one thing is that I listened to all the episodes on live, but she gave me the link to review again and listen to it again. And the important point is I learned a lot, and so many new points when I reviewed again. I think that's I have benefited more than anybody else. The speakers and moderators of the Marvelous Medicine are, believe me, they are the who's who in that particular field. I don't have any authority to criticize or comment on that particular speakers. They're all really the who's who's. They did it according to the time and excellent. So I cannot really comment or criticize what they were to do. So what I'm going to do, probably we'll say to short, what I'm going to do is what I have done, understood in those episodes. And I just wanted to rate them, and I have rated them all 5 stars, because I tried to get any negative point, I couldn't get it. So all the episodes I made 5 stars. The order I reviewed is from the first 6th episode, next 9th episode, then 10th episode, and then 16th episode. The episode 6 is actually incident report and learning, and the speaker is the right person, none other than B. Krishnamurthy, popularly called Kimu. He was my senior and teacher as well as Jibmer. At this point, I just want to tell everyone that I spent only 6 months in anesthesia and Jibmer, but I am more attached to Jibmer than I did MD from Chandigarh, because I am so much close to all the people and who trained them and inspired me to take up the anesthesia. The consultant doctor is B. Krishnamurthy, and he is the director of the NIBH as well as safety director. The best thing is that Kimu, at the beginning of the talk, he said, I am not the right person to talk, I'm not an expert. If Kimu is not the expert, you can imagine who else can be the expert. The highlight of this particular episode is, number 1, Professor Congley, his boss and my boss, as our great mentor, attended. And after about a couple of months, she expired. It's a great honor when they expired in the Marvelous Medicine. And if I am not wrong, that is the episode, the maximum number of delegates have been registered and a lot of discussion happened. The Krishnamurthy's talk was very extensive and it was in depth. In simple terms, he told me that patient expectations are very simple. Listen to me, don't harm me. I think that's what it's a very fantastic one. One of the frightening incident of medical errors was that he told, very frightening, is enteral feeding was given in the central line. And I can't believe that, but it can happen, and it has been really is very good. And at that particular time, he told me the WHO checklist as really a game changer in the safety of the patient care, and the medical errors are being definitely much less. Dr. Geethanjali, the Dean of AIIMS Bhubaneswar, is full appreciation of this episode, and Dr. Bagdi concluded the talk. It was wonderful and it was too good. Coming to the next episode is intraoperative neurophysiological monitoring. I still remember 20 years ago, we did a 12-year-old child mucopolysaccharidosis with cervical decompression and fusion. At the end of the surgery, the child could not move the limbs, upper limb as well as the lower limb, then needs a tracheostomy. This is the worst thing that can happen to a patient, and it is nightmare to the surgeon. From that incident, we started doing neuromonitoring, though there are a lot of limitations in children, which you heard during the talk. The episode was moderated none other than Dr. Shyam Vishweshwaran from Perth, with basic medical classifications in JIBMER, was specialized in biomedicals, physiology, and informatics and whatnot. Both speakers, Nitin Manohar from UAE and Dr. Kanchan from Mysore, they have been practicing neuroanesthesia exclusively, and they both are trained from NIMANS. Very well explained. Basically, even if you have not done neuromonitoring, you accept that how they have done it. And Nitin has told that anatomical concept of neurosurgery has been changed to anatomic physiological. That is, I remember 20 years ago, they're all important a total excision and then found some deficits. No, now it is only anatomy-physiological that has been taken into maximal safe excision, not total excision. It's a really beautiful concept. And he told simply, even I do neuromonitoring, I didn't understand much because the neurophysiologists come and do the monitoring, but neuromonitoring mainly depends upon the amplitude and the latency. And he has told very clearly, if there is any change in any of the signals, there is enough time to prevent the complications. I think that's a fantastic. You should have a neuromonitoring for every case. There are so many things we can do. Dr. Kanchan, as well as Dr. was very much thorough, and they discussed many of the aspects and with the case scenarios to complement Dr. Nitin at the basics. The discussion well moderated by Dr. Shyam and emphasized the concept of the teamwork. Coming to the episode 10, fantastic one, fetal interventions pushing boundaries. As I said this is Jagnath Chatterjee, is the who's who in fetal anesthesia, believe me. He is a phenomenal person. He's the director of fetal anesthesia from Colorado. It was moderated none other than Dr. Mohan Abraham, who is a pediatric surgeon, but is a coordinator for fetal interventions in Amrita and Cochin. He's trying to develop as much as possible as fetal interventions. And Dr. Devnath Chatterjee said it's a very multidisciplinary approach that includes genetists, nursing, anesthetists, psychiatrists, and whatnot. About 9 specialists involved. It is not a very easy job. And he said he will inform the consent is being taken, and it takes a lot of counseling, a lot of time, and all the obsessions given to the mother. So as for the fetal interventions, as I understand, there can be a simple, minimally invasive or open surgery, open fetal surgery, example, open fetal meningocele, and finally exit procedures. So during the, in India, we do a little bit of probably a minimally invasive interventions and some exit procedure in some of the hospitals slowly catching up. I don't think, to my knowledge, the open procedure is being done any part of India. I was understanding, I used to give a talk maybe about 15 years ago about fetal anesthesia. Actually, fetal anesthesia, 80% is obstetric anesthesia and 20% only pediatric anesthetist. We are not an expert in doing a fetal anesthesia. And there was one beautiful comment on that. What is the problem of the neurotoxicity? Because he said he will give high dose inhalational agents. He says that neurotoxicity is not proved in human, definitely even now. And it's really very difficult to counsel as well as convince patients for fetal surgery in US, and it is very difficult in India. Last 10 years, I'm listening and talking about fetal anesthesia, but I don't think the way in which the teamwork and the expenses and the expertise, it will take long time for the open fetal surgery to be taken up in India. But as you think of, when you think of 15 years ago, we were never thought that liver transplant, total lung transplant, bilateral transplant, all can be done in India now. Everything can be done. Why not fetal surgeries? That's what Dr. Bogdi said. Dr. Mohanram, please do something, and at least you promote something to do fetal anesthesia. It's a long way to go, but I hope definitely it will happen. Coming to the final episode.
Can I close it? Just 1 minute. Vidya, is there any time limit of 2 hours?
No.
I got it. Okay.
This is one minute. I'll finish fast. This is okay.
No, go ahead, Dr. Ramesh. No, I just got a reminder in my.
Yeah, that's fine. That's fine. That's okay. Because of all the talk, I like this episode 16 is vaccine vaccination. Because I tell you, all the three is the right time in March 2021 when everybody was scared whether vaccination work or what vaccination to take. It is the right time that to start it. The right speakers, another is called V Ravi, that's called Virus Ravi from Nimans, and Vidya is the ID Vidya from Rela Institute. And that was moderated by the right moderator, that Bishwarup Paul, very well educated, well informed, beautiful moderator, and he is from Hyderabad. And just want to summarize some points is Dr. Ravi classified in March 2021, they classified various vaccines when we are all really don't know what's really happening. We all learned only from the Hindu and Times of India, not from the exactly Dr. Ravi. And he told only two things. Covaxin is inactivated vaccine, but it's a old known platform, very reliable. Covishield is a viral vector based, and it's going to be really a game changer. And if this Covishield is going to work, he says they deserve a Nobel Prize. He concluded that all the people, either you vaccinate or you get the disease. There's nothing can happen in between. That Vidya was very pleasant, very humble, with clear concepts. The mantra from the beginning was don't hesitate, vaccinate. I think that's a mantra she started. And she told very clearly, when we were worried, the vaccine productions, it's a max done at the max speed, where vaccination production as well as the clinical trials were done simultaneously side by side because it's a pandemic. So it came within 1 year, all the results, and we had the vaccination. And India has done almost about 60 to 70% by this now. It's a great work done in India. And finally, she helped a lot of case scenarios with the health workers, where in Tamil Nadu, only 20% of health workers had the vaccine at that particular time. Really very sad. But then she told me, Covishield is like a love marriage and Covaxin is like an arranged marriage. So I think that's how he told, and it understood all the points, everything. And Sanjay Arora from US is a pediatrician, explained a little about actually Madonna trial. The highlight of the episode that after every question, Dr. Ravi answered with definite answers. Definite is a real definite answer, and will end with that answer over. So there's nobody can ask anything else. So it's so definite about it. Yeah, that's over. So no question is asked on that particular subject. So he's so authority in that particular subject is very good. It was about 40 minutes presentation and it was 60-minute discussion, very lively. From that day onwards, I'm sure all the health workers started vaccinating. I'm sure Vidya had the first dose. I think she had the second dose after that. And I started adding Covaxin after some time. It's really stimulating. I told everybody, please have the vaccine. Either you vaccinate or you have get the disease. Thank you.
Thank you, Dr. Ramesh. The next speaker is going to be Dr. Karthik. He's done his MBBS, MD, and DM, all from JIPMER, and is currently assistant professor in Sri Ramachandra Medical College. I have followed Dr. Karthik's brilliant comments in the Facebook on different topics from academics to others. Dr. Karthik, take over.
Thank you very much, sir. So I'll be brief since we are almost nearing the end of the time. When Vidya madam asked me to do this, I had an acute attack of imposter syndrome. So I just hope I do my job slightly according to expectations. I was given 5 topics. I'll start with the one that is closest to my line of work, that is perioperative diabetes management. Of course, ours is not just perioperative; it's the whole part of diabetes. The speaker was Dr. Surendranath. He did a fantastic job. The thing that I liked about the topic and the way he gave the presentation was the pace of the presentation. In cricket, we might say it right arm, medium, fast, something like that. It was neither too fast nor too slow. It was adequately paced, easy to follow, and he covered nearly every aspect of perioperative diabetes management, the short period of time that was given to him. Occasionally, brand names were used, which could have been avoided, but that's just a minor quibble there. So otherwise, the topic was relevant. And in fact, it was the first time when I shared it in social media handles, people from other parts or other WhatsApp groups asked me to share the link of the recording later on. So that was quite useful to everyone. Then there's this talk that I really liked, How I Read What I Read by Professor Ram Rajagopalan. It was by far the most engaging of all the 5 talks that I had listened to. It was clear, straightforward, engaging, humorous, and basically had a tinge of universality to it. Whether you are a surgeon, anesthetist, physician, or anything in between, it's important to know how to make sense of medical literature. And that is how this talk had a sense of universality to it. The only con I could think of was the length of presentation, which basically holds true for all talks. I personally feel they could be a little bit trimmed down, but again, I'm not sure whether it is my attention span or it's a common thinking across the board. I'm not very sure, but I do feel that no one has ever said, oh, this presentation lasted only 20 minutes, it's too short. So based on my limited experience, I think it could be shortened every one of these presentations. So that was how I read what I read. Then registry, the importance of registry by Dr. Deepan K. Menon. The thing about the talk was that it had a lot of theory in it, and that kind of theory, unless we plunge into some computer science or some specialized books, I don't think doctors would have access to or chance to experience the development of a database and so on. And Dr. Menon basically nailed it. It was a nice talk. The only thing that I felt was that it was all of UK, US centric. There was very little Indian focus in that. And that was one of the minor negatives which I felt could have been addressed in that talk. And then there was this acute kidney injury in the ICU or CCU by Professor J. Radhakrishnan. It was an excellent lecture. Again, he needs no introduction. He's a global expert on the topic, and he carried the presentation very well. And I couldn't think of any cons or anything bad about that lecture. And finally, pharma as a career. This was by Dr. Ravi Shankar. It was an interesting topic, and frankly, I felt this topic could be addressed even to second-year MBBS students who do not get nearly as much exposure to what happens in the real world, especially in the pharma sector. We used to have, the Farm Fest, where we have weekly tests for 3 weeks in a row. But I always wondered what would happen if we had some kind of industrial visit, just like the engineering students have some industrial visits in 3rd or 5th semester. So why wouldn't we have some visit to some pharma company? I always thought. And after listening to Dr. Ravi Shankar and the nuances of drug development, I still feel this talk should reach a second-year MBBS student as much as possible. Again, the other issue that I have to say is the rather limited Indian context to the whole talk. So this was the JNS head looking at the past, what was there in those 5 talks. Most of you would have listened to those talks. If you had not listened to those talks, whatever I had told would probably not make much of a sense because it was too much of condensation. But going forward, I think I could give a few suggestions. We have seen several of these suggestions again and again as a recurring theme in all the reviewers. One is the relatively little audience engagement outside the Zoom meeting. For example, in most of these videos, the subscriber to like ratio was very, very less, and there was 0 comments in each of these 5 talks in YouTube. So I'm not very sure why that is happening. Perhaps an audience analysis could be done. Who is actually listening to it? Who we want to reach? And maybe a survey after the talk and before the discussion would tell us exactly who is listening to it, exactly who we want to reach, and how to bridge that gap. An audience analysis would be an absolute must, I think, in going forward. Second is to trim the duration of the talks. That would really be quite useful obviously it would be much more attractive in my opinion. And the third thing is to have an Indian context whenever the speaker is from the US, UK, or any other part of the world. So they could be roped in as co-speakers, not only as moderators, but also as co-speakers. And as the previous speaker mentioned, it could be inclusive to have people from the government, academia, private practice, corporate practice, and so on, all in Indian context. So that makes it much more useful to our listeners, provided most of them are from India. Yeah. So the other couple of things I would like to suggest are to involve undergraduates or to involve actual JIPMerites who are doing MBBS in JIPMER right now to be audience to these talks. Since everything is done online, I think it should be quite easy to get them on board. In fact, it could be sent as an invitation to JIPMER Scientific Society, which does one meeting every month. Maybe they could even show it in their auditorium. That's where the JIPMER Scientific Society happens. Or we could even make a public calendar to which any JIPMerite can subscribe to, so that it pings them whenever a meeting is scheduled, and so on. So the ultimate aim is to make these videos reach a larger audience, to make it more useful to them, to add a little bit of local flavor to it, and perhaps reach out to the undergraduates or current postgraduates, so they get to see some things that they wouldn't routinely see in any of those pharma-sponsored meetings that keep happening now and then. None of these kind of things would be discussed in those meetings, and therefore it will be of real use to our undergraduates and even postgraduates. So that basically sums up my understanding of my feelings about this 5 topics that I reviewed. Thank you so much.
Thank you, Dr. Karthik. You brought up several important comments on, especially on the online education, doing a stakeholder analysis. And the biggest limiting factor is time. As you said, both students and staff have limited time. So how do you make an impact with a powerful presentation in a shorter time? And those are very good suggestions. And medical students are so overburdened with everything else that to add something else, you have to really make it interactive and experience-oriented theme for them to make it. So very well taken. Over to you, Ravi. You had another reviewer.
Right, I have Chandra. No, yeah, I have Chandra. So we have gone way past our original time. So apologies to everyone. And thank you for the audience for staying on. I'm going to go slightly off script when I introduce Chandra by saying that a a couple of days ago, I had the opportunity to call into a talk from the PGI telemedicine group, which was on the long COVID, particularly pulmonary involvement by none other than Professor Jindal, the father of pulmonology in India. One of his comments was that the best lung transplant center in the country and probably in Asia is the KIMS group in Hyderabad. And that made me enormously happy to hear that, because Chandra is the executive vice president and the director of KIMS. So, but that's not all there is to it. He is a very, very multi-faceted individual, including, being the president of the Kamala Hassan, whatever society. Chandra, forgive me for not getting that right. I think it's something to do with the Global Kamala Hassan Fans Unit in Hyderabad, as well as phenomenally well-informed about anything to do with movies. I can go on about Chandra. He's obviously very multifaceted, but that I'm going to hand it over to you, Chandra. Definitely a huge fan. So go ahead.
Am I audible?
Yes.
Thank you, Dr. Ravi, for the good introduction. I have 5 topics to review today. I'll start with the first one, eye to eye with the Chakrabartis, Dr. Arup and Dr. Meena. No doubt they were an inspiring couple. So as a disclaimer, before I start, I would say that there are, I've chosen more points which are negative or critical about each talk than what was positive. And I know that we are today living in a society where any criticism, then you'll be anti-national or whatever, anti-organization. It is not like that.
Chandra, your brief is to be critical.
Yes. So
you're the only one who's sticking to the brief.
Yeah, I hope I'm not anti-national, and I know that time is running out, so I'll stick to exactly 1 minute per talk and finish it in 5 minutes. So very, very inspiring couple, and it was apt that Dr. Vidya pointed out that the man is anterior chamber, and the lady was always behind him in the posterior chamber. That was a very good analogy. And it was very good to see 3 levels of things, always like one above and one below. So they talked a lot about their teachers, the ones in Aravind Eye Hospital where they trained. And then in the end, in the discussion, there was a lot of talk about whom they mentored or their students who are doing very well now. So it was like 1 step back and 1 step forward. That gave a completion to the talk. Negative point, I would say that it was very short duration compared to usually our talks are like 90 minutes, but this one got over in 1 hour. Probably I would put the blame on the moderator. There was nothing from the moderator to contribute. I don't know who it was. I think Vidya ma'am, you only, or was it Dr. Giridhar, my friend?
No, actually,
no, it was me.
Radhakrishna wasn't available and we had to use the free Zoom. So we had to finish in an hour. That's the secret.
So the discussion part in that was a little bit lacking. That is what I would feel about the that talk. And the challenges faced in setting up their unit in Trivandrum, I think a little more could have been elaborated upon for other entrepreneurs to follow them. But another cute thing which I loved about in their talk was, throughout the talk, Dr. Arup was mentioning Aravind Eye Institute as Aurobind. I think even the Malayali had lost her accent, but the Bengali was totally with his accent. So it was like Aurobindo Ashram, he was telling Aurobind Eye Institute. So I thought it was a Madurai-based Aravind Eye Institute. So that was a very cute thing there. And then we were wondering why Keralite always gets hooked up with Bengali. Probably the communist background has something to do with it. These are 2 very communist background states. Maybe that is one thing.
And the fish.
Yeah, the seafood. Absolutely. So the next topic I'm going into is the financial planning for the doctors. It was a very good, excellent topic. There is no doubt in that. Most of us are very poor financial planners. Like I know that I spend 150% of what I earn. So I was looking forward to this topic a lot. But negative, if I have to say, the Shyam Shekhar, the main speaker, I don't know if he's there listening to it. The PowerPoint I felt was too generic and too theoretical. So I enrolled myself in a cricket camp thinking how I'll make a quick 50, how I'll hit sixes. So I want some quick tips. But I thought it was more like you should have mental balance. Every day you should exercise for 2 hours. You should read the minds of the opponent. So I got general tips like that from his PowerPoint, which I already know. I only don't know the practical points of how to make money. I didn't think that came very much from his PowerPoint. But then the discussion part was excellent. Even him, Shyam Shekhar also contributed excellently in the discussion part. Mainly, I think because of Mrs. Renu Maheswari, who was the moderator, and Dr. Kala, I think she was an anesthetist. So they took up excellent discussion and a lot of pertinent questions were asked. Only thing I felt that there was too much of bias towards the women folk, and at one point it got too much into how lady doctors should make money. So I think that even gent doctors also need to make money. And as I said, I was looking for some quick fix formula to make money and some tipping points, which I did not get from that talk, even though it was of a long duration. The talk was for more than 2 hours. And I would have expected little bit examples on, say, I have 50 lakh income, what I do with it percentage wise. Like when you see the budget or the income tax rules being announced, the newspaper would tell you so and so is earning 20 lakhs, so and so is earning 1 crore. And then they'll give a formula for how you can plan your wealth or your tax. So I thought some formula will come in that way, which was not there. But again, as I said, the question answer session was excellent with both Mrs. Renu and Dr. Kala asking excellent questions. And there was an excellent take home point about insurance, that other than term insurance, any other insurance is not an investment and it's a waste of time and money. That was excellent. And there was very good discussion about whether to invest in equity or in fixed instruments like the debt instruments or mutual funds. That was again very good. So this was the plus and minus about the financial planning for doctors. And then another topic which was very close to my heart was the liver transplant surgeons. So I really look forward to this because people like Sonal Asthana, my friend Fani Krishna, Dr. Ilango Setu, Dr. Ravi, whom I met in Birmingham after such a long time, Srinivas Reddy, Rajnikant, all were extremely close friends, and liver transplant being very close to my heart, I thought that it would be a great session. Yes, it was a great session, but again, I'm going to point out a little bit of negatives. One, the session again exceeded its duration. It was more than 2 hours. Professor Ananthakrishnan, like he is such a phenomenal person. So I felt that he was not the correct moderator for this session. The reason I'm telling this is, you ask people like Virat Kohli and all these youngsters to talk, and you put Sachin Tendulkar as the moderator, they ended up speaking more about Tendulkar than about their own journey. I think the talk was about what was their experience about liver transplant, how the youngsters should prepare for liver transplant, what are the challenges and opportunities in that. But I thought the session was more going towards Chipmer MS surgery, especially unit 1, of which Dr. Ananthakrishnan was the chief. So because he is Tendulkar, you put Tendulkar as the moderator, whoever is going to be the speaker is going to speak a lot about Sachin Tendulkar and not on the topic. Am I there?
Yes.
So this was one negative. I thought that people were getting overwhelmed with the presence of Professor AK, which is very natural. And I would have loved to hear a little more about what are the challenges and opportunities in liver transplant scenario in India and abroad. Little bit of more technical discussion about what are the challenges in doing a living donor liver transplant versus a cadaveric liver transplant. Which are the best training centers in Europe? Which are the best training centers in India? Which are the best training centers in US? How an aspiring liver transplant surgeon should prepare himself. But I thought this topic went little astray in that way. and I attribute to the presence of Dr. AK with due apologies. The next topic is ultrasound for surgeons. It was like this was a brilliant topic and brilliantly presented by Dr. Sri Priya. And um, only thing, I have three reasons why I could be biased towards selecting this topic as the best that I had ever attended in the LGS forum. One is obviously ultrasound. I'm basically a radiologist, though now I am into management. So probably there is a bias towards my parent specialty on this. Second is Dr. Sri Priya's screen presence. I already mentioned this. So many of us can only wish to be having such sort of a screen presence, but she has such smart looks and screen presence. So that is a compliment. And the gimmicks were only adding to the screen presence. And the third and most important point is I saw my brother-in-law Bala, Dr. Bala Murugan, and my sister Sauba together speaking for the first time in my life, I think. The last social event which I remember they both attended was way back in 2000, and that was their wedding. After 21 years, I saw them sit together and speak to me. So maybe I'm biased because of these things. Other than that, the best part of this talk was the PowerPoint presentation. The images which Dr. Sri Priya had of the liver and the torsion and all those things was phenomenal. And the way she explained ultrasound physics in such basic terms that any doctor, anyone in MBBS level would understand was excellent. It was a very lucid presentation. And the moderator here was very good, Dr. Jairaj Govindraj. I knew him from my radiology times. He also played a brilliant role in moderating the session and giving us valuable inputs. And it was a very good discussion on whether surgeons should do their own ultrasounds or they should leave the bit to the experts, that is the radiologists, to do this. In this, Dr. Ilango Sedu, because he told that he himself is trained well in ultrasound and now he is a transplant surgeon. He brought in brilliant points. Dr. Bharti Dala, of course, brought in some brilliant points. And Dr. Bala, my brother-in-law, he spoke about how reducing an interception when a radiologist is not available in the night. So if a surgeon knows a bit of ultrasound, he can do those things, and then he can drain from loculations. These were brilliant points raised. It took my memories back to ultrasound as a modality when I was doing my MD radiology in JIPMA. Dr. Sripriya showed the images of intrahepatic biliary radical dilatation. So after doing an ultrasound, if I tell there is IHBD, intrahepatic biliary radical dilatation, query cause. The next day, I would be summoned by my senior, Dr. Rajesh Kannan. Now he is a very famous cardiac radiologist. He is in Amrita Institute in Kochi. I think Dr. Suma Balan would know him well. So he was my senior. So he would call me to the CT scan room and then show me my report and ask if you have to do an ultrasound until there is intrahepatic biliary radical dilatation. Tomorrow, the housekeeping person also can do this ultrasound and tell the same thing. And you have told query cause. You are here as a radiologist to tell me what is the cause, whether it is a calculus, is it a distal CBD stricture, or is there a CA head of pancreas, is it a preampullary carcinoma. If you are not able to tell this on ultrasound, then you are not fit to be a radiologist. This is what he would tell in front of another 10 people. So I just remembered when Dr. Sripriya told about the IHBD and the liver images. So it was excellent. And she also mentioned what are the different probes, various frequencies which are useful to see the superficial lesions. You have to go into the high frequency probes. That was excellent. And the topics about hemoperitoneum, ruptured ectopic. I think it was a very well made presentation. I have very less to tell, maybe because of my biases again. And then the last topic I'm going to review is again very close to my heart. That one probably ultrasound is on the ventricular chambers, but this one is right on the pacemaker. This is organ donation in Tamil Nadu. It was such a pleasure and privilege to listen to someone like Dr. Samaran Nandi, the father of liver transplant in the country, to speak. And that was only possible because of the LGS forum and people like Marvelous Medicine Forum, because of Dr. Vidya and Dr. Pata Radhakrishna. So I can never be more thankful to them. And it was excellent to listen to Dr. Amaloparanathan Joseph, who again, along with Madam Jayalalitha, when she was the CM, I think Tamil Nadu rose to the peak in organ donation because of people like them and Mr. David R. It was very good to listen to the government point of view from a Babu, or a so-called government official, his experience with doctors on bringing up organ donation in Tamil Nadu. It was excellent. All three, Dr. Samaran Nandi, Dr. Amalot, and Dr. David R. and Mr. David R. all three were legends, and it was so good to listen to them, especially Dr. Amarul Pranathan was speaking about evolution of the Organ Transplant Act and how they had to go multiple times to Delhi and formulate the act. That was excellent. And liver transplant being one of the very passionate subjects to me, I felt this topic, probably among all the topics of the marvelous medicine, I rate this best in my opinion. And also because I have done a postgraduate diploma in medical law and ethics from National Law School, I could relate myself to what were the pitfalls of the act. What is the excellent discussion between why transplants are not done much in government setup, and most of the transplants are done in private setup in India, especially the liver transplant. Negative side, I thought that little bit more could have been added about experience of other states. Today, Tamil Nadu is not number one in organ donation. Telangana, Hyderabad is number one in organ donation. But I thought a lot of focus was on Tamil Nadu, and a little bit more focus could have been given on other states like Maharashtra and Telangana, which are also doing a very good job in organ donation. I thought a little bit we could have discussed more on cardiac death donor, which is going to be the future. If not now, in 5 to 10 years, brain death is one thing, but cardiac death donor is also going to be a very important topic in organ donation. And I thought this topic should have had more participation from clinical transplanters. Most of these people who are there in the liver transplant surgeon thing, they were not present in this topic, which was very relevant to them. So we would have listened a little more to the clinical side and the challenges in doing a disease donor transplant. On the whole, it was an excellent discussion, and I'm really proud to have been part of giving that lecture on corporate healthcare also. And whatever criticism I have made is always for improvement. And I've highlighted the negative points a little more, so apologize me for that. But it doesn't take anything away from any of the 5 topics. These were brilliant topics, brilliant speakers, and brilliant moderators. There is no doubt in that. Thank you.
Thanks, Chandra. I think with that, we should wind down. I am going to thank every single person who attended and all of the critics for their phenomenal amount of time and effort that they put into it to come up with very valid points. So thank you so very much. I am going to, on behalf of Ghosh, Amit Ghosh, Ilango Setu, and me, I'm going to hand it over to Vidya to close the session. Thank you, Vidya. Thank you, Patta. Phenomenal situation. We cannot, actually, you brought us to a point where we cannot imagine a Thursday without marvelous medicine. So I think that is to your that's the best I can say about you. It would be a terrible Thursday for us if we don't have marvelous medicine.
Thank God it's
no
Thursdays.
pressure with you. Yeah, no pressure with you. No pressure with you. So yes, and thank you.
Nalla, I think I heard you. So you're going to have the last word. Nalla? Was that you?
I said, ma'am, thank God it's Thursdays.
Oh, that's you. Okay. Right.
Yeah, so, thank God it's Friday. Yeah.
So you're going to have to make do with Diwali next on November 4th. I'm just warning you in advance. So, Dr. Sridhar, if you're there as a senior patron of our LGS and Marvelous Medicine, we'd like to hear from you.
Yeah, it was a wonderful thing. I think it's a great journey, Vidya. I think I must congratulate you and Patta for the efforts. I don't think anybody can do this monumental work just but for you. I think it is just an impossible thing. I think I really congratulate you for this. I'm looking forward to every Thursday from now on.
Thank you so
It's a
much.
marvelous thing.
Thank you so much, sir. If any one of you would like to say something, please raise your hand or use the electronic hand raise. or just unmute yourself and speak. We can hold
Yeah,
it for another 5 minutes.
Nalla is coming. Nalla, unmute.
Dr. Dedipia, we are overwhelmed by Jipmerites from this forum, so we'd like to hear from someone who's not a Jipmerite like Tilaka and Ilango.
Thanks, Dr. Vidya and Dr. Bhattacharya for putting it all together week after week. I know it's no easy task choosing the topic, getting the speakers to agree, getting moderators, and sending the invites, and then monitoring it. It doesn't go monitoring it, recording it, getting people to review it. Wow. If you can break it down, I think it's been. I think it's brought people from different backgrounds of specialization, medicine, anesthesia, surgery, radiology, and has something for everyone. So we understand more of what is current. And I had the opportunity of doing one of the sessions on where eagles dare, ICUs in semi conditions with Dr. Ganapati and Suzuki, both of them speaking about their experience. Nice. Listen to other topics as well. And really nice to listen to the reviews by people who've taken the time to look at each of it and be critical. Very nice. Thanks. Looking forward to interacting with you all again on Thursdays with Marvelous Medicine. Kudos to all of you here.
Thanks, Dedipia. Over to you, Nalla. Looks like Nalla's audio is giving him some trouble. So,
can I say something, ma'am?
Please go ahead.
So, it's been an absolute pleasure listening to all of you always, and I think I've recorded this already. I am so jealous of you people because I'm not a Jipmerite, but I truly consider myself to be a part of this group, and because of this, I have more people to whom I can always I look forward to, and I ask a lot of things about. So thank you so much, and I truly am very jealous about the type of unity that you guys have, the kind of discussions that you have. I'm not able to have it with any of my people. So I mean, great.
Vidya.
Yeah.
Vidya. Sorry, Vidya. I was not at home, so I could not sit with my laptop. I just got back from work on the way back. Lovely. I always appreciate all that you all have done, and I'm very thankful for what all you have been doing, and the opportunities that you have given to everybody to come forward and show what they can do in their own field. I'm audible?
Yes.
Yeah. So thanks, Vidya. It has been lovely, and thanks, Pata, and nice Ayudha Puja. I think I can never forget our Ayudha Puja OT celebrations in Jipma.
Thanks, Nalla. Arvind, would you like to say something?
Thank you.
Arvind Krishna? Arvind, you need to unmute yourself. You're muted.
Oh no, I was just I just saw a chat message. It said switch on the cameras and everyone needs to.
Turn your camera on. I thought you wanted to say something. Anyway, thanks for
Yeah,
joining
so
in the midst of your clinic. And
can you hear me?
Yeah.
Yeah. Okay. I was just switching it on because in the chat message it said everyone needs to switch on the cameras to give a standing ovation for your wonderful work. So that's the reason I did that. And reaching out to the global audience, I'm in the US, and all the programs, the topics, it's been wonderful. So to be included in that.
Yeah, I think it's a wonderful 2.5 hours, not just 2.5 hours, 72 plus hours of this marvelous medicine. And I think the icing on the cake is this reviews. Each one of them are reviewed so very well. Like actually, they've exceeded the excellence of the speakers. They've done very well. And before we close, there's only one thing I can say: the soul, the heart, the mind, everything of Marvelous Medicine is Vidya. And she eats, drinks, sleeps Marvelous Medicine. And just after this program is over, she'll send me a message that when are you getting the next flyer ready? She'll say that before she sleeps. I only do the flyers and nothing else, and all the credit, everything goes to Vidya with the help of stalwarts like Amit Ghosh and Ravi Shankar
Madam does
and a
the
couple
flying.
of others.
Sorry?
Vidya Madam does the flying, sir does the flyers.
Fly, that's right. Thanks once again, and please keep supporting. And actually, I think all the criticisms and all the advice are well taken. We need to spread the message about Marvelous Medicine in every possible way and make it more visible. And again, welcome you all to join and bring some more friends into this program, and so that Vidya's efforts will not go in vain. Thank you. Good night.
Thank you everyone for joining in, and really sorry for having you. Now you understand how these programs get longer, right? Now that you're part of it. When you're reviewing, it's very easy to say we should have finished in 1 hour, but when you're actually doing it, things just go out of hand. So, but most of the time, the timing that we have given to the speakers is 40 minutes. I would like a quick show of hands to those who feel that we should not give 40 minutes to the speaker. We should give less. Quick show of hands, please.
None.
Okay. So the rest of it is discussion. So the 40 minutes is what people are, for want of a better word, forced to stay in. And after that, the discussion is left to those who want to stay. So we don't want to turn away people who want to continue the conversation. And that's how the program gets longer. So I wanted this feedback about the timing of the talk. So thank you, everyone. And for all your good wishes and all your praises. And we'll go through, just like you all went through all the other episodes to review, Pata and I will go through the recording of this to make sure that we take every feedback, both positive and negative, to take it forward. And I don't know whether you all planned it among yourself that you are talking about 500 episodes, but I may not be alive by that time. So let's look at 100 for now. And thank you all for your support, and good night. And we'll meet again next Thursday for yet another episode of Marvelous Medicine. Good night and stay safe.